Um, so today we're going to talk about one particular method that we've been applying in this project called small area estimation. And I'll motivate it with a very practical problem. So oftentimes we have details on certain sampled locations, and maybe we have a good coverage of those locations. Often that can be through like DHS surveys may give us some of these kinds of samples that we know roughly where they are, maybe not exactly their location, but we know at least what district they're in or what, sort of a second level administrative unit they're in. And we have decent coverage across much of the country, but it's not full spatial coverage, right? So we have detailed sampled locations. And often, as I said, this can be through DHS or sometimes through living standards surveys, the World Bank's living standards measurement surveys or other detailed surveys that try to, that are long form surveys that get a lot of details, but maybe have smaller sample sizes, but still enough to give us good coverage over a certain area, right? And in the health domains, this could also be things like health conditions or disease rates. In what we're talking about here today, we'll talk about mostly expenditures and consumption, but we'll also touch on how these methods can be applied to other contexts as well. And so you have these sampled locations, but what you need or what you want is like this full coverage of an area so that you can estimate inequalities or target populations that you need to target interventions for, right? And so this is the problem context that we're working with, okay? And we want to think about what are some ways to get from these point sampled locations to something that gives us a full spatial understanding of what's happening. There are a couple ways you can do this. You can just take your sampled locations and you can sort of smooth them throughout space, right? And that's just taking a point location and saying like, well, between this point and this other point, I'm going to do some estimation and just interpolate what should be happening in the in-between spaces. And that's what we would typically do if we had things like rainfall, right? We have like locations where we know rainfall, then we're going to just smooth over the space and say, well, if it rained 3 centimeters here and 2 centimeters over here, then it should be somewhere in between, in the in-between spaces. So you can do something like that. But typically for health and for population data, those aren't good assumptions to make, and we can often do better. So we typically don't do that. You can also use things like land use regression. So if we have things about the landscape that give us information about the variance of our outcome of interest, then sometimes land use categories can help predict those changes too. But again, with population data, if we're working on data for that relate to people, land use isn't always the best, aren't always the best predictors of how those things may vary across space and in between places where we don't have samples. Okay, so a third way of doing this is through small area estimation. And small area estimation, there's nothing specifically geographic about what small means. It just means that you are taking point samples from one data set and applying them to another data set where you have those estimates in smaller geographic units that you want full coverage over. So small area estimation is really just trying to get down to some sort of finer resolution, but it's the name that's applied to this set of techniques. And what you need for this is you need a common set of predictor variables between 2 data sets. Okay, and we're going to talk about what that actually means in just a moment. These common predictors would be in the sample data set where you have all these point locations, and also in the full coverage data set. And that's sort of key to how you make this translation happen, is that those predictors can be used to develop estimates, statistically to develop your coefficient estimates from your sampled locations, and then apply those coefficient estimates to predict coverage in your full spatial data set. And if it's easier to see in equation form, then what we have here in our estimate side is we have this set of X variables that are going to be predictors for our outcome, for our Y. And then we use these to develop our coefficient estimates, and these same X variables then are used over here. And we use those X variables and their coefficients to then predict Y over here. Okay. So we have some detailed data set with an outcome of interest and predictor variables. And then on our full coverage data set, we have those common set of predictors, and then we predict our Y. Okay, so for example, we may have our outcome Y may be, it can be, well, this is sort of the beauty of this method, is Y could be any kind of metric that you have available in your detailed data set. And as long as you have the covariates that also can match up in this other data set, then you can predict Y in the full coverage data set. So the key here is that the data must be sort of from the same general population, right? We don't want to take estimates that are developed in the UK and apply them to Ghana. But if they're the same general population, same types of households in the same areas, and with the same coverage, then we can sort of consistently or theoretically predict these relationships. You need to have representative and a consistent set of geography that you're predicting over, and you have the definitions of your X variables, these covariates. They need to be defined the same way, and you need to do a little bit of homework to make sure that they are actually the same kind of thing, which is usually checking the distribution of those variables and making sure that the distributions reasonably overlap, so that it's clear that they're actually measuring the same thing from your population. There are also different ways of developing these estimates. So sometimes you might think about predicting your variable at the unit level, which would be typically at the household level or sometimes at the individual level. Or you can develop estimates that are at the area level. So instead of, say, like in our context here, instead of looking at household income as the thing that you're predicting, you could also predict just the median income in a certain area, or the poverty rate in a certain area based on the predictor variables. So and depending on the data that you have, may give you reasons for doing one of these over the other. But all to say that these could be some spatial level of an estimate, or it could be at the individual level within a spatial area. And just a few, just to show that there are lots of ways that these have been applied. So as I mentioned today, we're talking about income as the thing that we're trying to understand or predict. But it has been, I did just a quick search of even just the health domains, and there's lots and lots of work done on, on different sets of diseases and disease rates, even things like health insurance coverage, life expectancy. Recently, there was a paper came out on COVID testing rates that were all using these small area estimation methods for all of these different outcome measures. Today, we're talking about income distribution, and in there's a whole almost separate body of literature that uses small area estimation methods for income, but comes under an umbrella of poverty mapping. And so partly, understanding the whole world of small area estimation and the world of poverty mapping, they use very similar methods, but the terminology is sometimes quite different. And to complicate things more, one of the major players in using these kinds of methods has been the World Bank in sort of an applied and project-driven way. But the World Bank's methods were quite different from academic methods until about 5 or 6 years ago, when the World Bank said, well, okay, we should probably use some better methods. And so what the World Bank was doing until recently was also not in line with the academic literature. But many of the applied examples come from the World Bank. So it was also very confusing trying to understand that. So there is a lot of information out there on these topics, and a lot of guidance. But if you go back very far, then it can be a little bit confusing. But the language that I'll use today, and that I've been using, is I'm going to stick with just small area estimation, not saying poverty mapping, and the models that we're using. I'll use just sort of a standard, what I think is the standard sort of statistical frameworks, and mostly these are rather simple multi-level model, multi-level regression models that take into account an area level fixed effect. And that's part of what makes them useful in trying to do the prediction, is that you have some effect on a spatial area that allows you to have some idea of what unobserved covariates may play, what role they play in the outcome that you're interested in. Okay, so I'll talk now a little bit more specifically. So that was a little bit of just like the sort of background on the method. I'll talk a little bit more specifically now about how we applied this in Ghana for the base data set that we developed. And then Alicia is going to take over and give some more particular examples about how we've used this in developing papers and in our research in the Pathways Project more broadly. So for Ghana, we used our survey data set. Our detailed data set was the 6th Ghana Living Standards Survey, which had a sample of 18,000 households, which is a lot, but that's not full coverage over the whole country of Ghana. But it does give that Living Standards Survey gives really detailed information on consumption, right? And consumption being the measured how much people are spending on a basket of goods. The Ghana Living Standards Survey also gives detailed information on household demographics. And those are the covariates, primary covariates that we'll use to then match up with the 2010 population and housing census from Ghana, which will be our full coverage data set that we're now trying to predict income for. So the challenge was we wanted full coverage data sets so that we understood, especially within Accra, how income and how the income distribution varied over the urban fabric of Accra, which we had lots of data on households from the census data. And I'll recognize now too that the 2010 census is, of course, more than 10 years old now. But at the start of our project, one of the reasons that we went through the efforts to do this was we worked with the Ghana Statistical Service and also got 100% of the full Accra or the full Ghanaian census. And so we applied these methods on the full 100% census data. So everyone that they had recorded from Accra in the 2010 census, or from all of Ghana in the 2010 census, we applied these methods to that data set, which made it very powerful. And we had the Living Standards Survey that was done in 2012 that matched up with it pretty well. So our data set is a little bit out of date, and the 2021 Ghanaian census was just released this past year, so we haven't had a chance. Well, and all the spatial information that we need to go along with that 2021 census has also not been released yet. So we're not able to apply this yet on the most up-to-date census, but my understanding is that's forthcoming very soon, and so we'll be updating this when we do get all the information we need on the 2021 census. But to say here is that we had detailed consumption from the GLSS, and we had we knew a lot about households and where they lived from the census. So we used the income or the consumption information from GLSS, and we developed estimates about how that relates to household demographics through employment and education, household size, the types of housing materials that you have. And then we applied those estimates to all that same information from the census and to predict income. And we control for household size by using this equivalized household consumption that just says, it basically gives you almost a per capita consumption measure, but scales a little bit for the household, for the size of the household. So that's actually what we're predicting. And we predicted log of income because we want to be able to predict variables that have normal distributions. And if we take our standard just income, income is almost always skewed. Income distributions are almost always skewed, but if you log transform them, then they look very normal, which gives us better statistical properties for doing the things that we need to do. One problem, though, is how do you choose which variables to set as the common things that you predict off of? Between the GLSS and the housing, the census data, we could develop, in theory, we could have had 500 plus common variables, common X variables. So how do you choose from those? And there are lots of ways to think about doing variable selection. Oftentimes in my own work, coming from more of an applied econometrics background, we like to use theory to drive our variable selection. And so usually that's the way that I work, is I say, well, the variables that you include in your model should be related to the types of things that you expect to see or the theory that you're trying to test. In this case, however, we're talking about really just trying to find the best predictors of an income. And so since we're focused on prediction, then theory doesn't play as large a role. It's really just like, what are the best covariates that we can find that will help us accurately predict the thing that we're looking for. And so in that case, there are other types of variable selection methods that you could use as well. There's different kinds of stepwise selection, forward and backward, elimination procedures for regression models. There's model fit tests you could use to try to ad hoc sort of figure out which variables to include and not. Here, what we ended up doing was what's called lasso regression, which is a form of penalized likelihood. So it's an algorithmic way to look at the log likelihoods that come from different models with different strengths or weights that you place on your covariates. And the lasso regression ends up setting some of those weights on your covariates equal to 0. So effectively eliminating the influence of some of your covariates, and those are the ones that you end up dropping from the model to maximize a likelihood function. And in this way, we're able to take a much larger set of variables and bring that down to about 20 different covariates that we would choose to represent our predictors for consumption from the GLSS, and then select those same variables to predict income in the housing, in the census data. We also developed regional models in Ghana. So we didn't do one big prediction model for the whole country. We broke it up and did it regionally, 10 regions in Ghana. And so we have 10 different models with potentially 10 different sets of variables that we're using to predict income, right? You can imagine households that are living and working in Northeast are going to have very different things that predict their levels of consumption than households that are living and working in urban Kumasi. And so we allowed for flexibility in that and developed models that were based on the region and didn't try to fit that for all of the whole country. Okay, and so if we look at this from an equation standpoint, if some of you find the statistics a little easier to understand when you actually see the variables that are in the models. So the key here is that our X is our covariates that we've been discussing, those population, demographics, education, income, housing characteristics. And this, what's key about small area estimation methods, and this is the part where it's a multi-level model or a hierarchical model or a mixed effects model. These are all the same things too. Is that we have this VJ here, which is an area level effect. And so that just says there's something about this area that allows us to predict, more accurately predict a level of income than just the covariates alone. And so essentially that's saying that there are things that we don't observe that are not in our model, but are associated with that area that allow us to say something about income. And so these area level effects are key to this small area estimation method. So first we fit this model to survey data. That's our GLSS data, to develop our beta coefficients and our parameter estimates for these variables. And then we use this set of parameter estimates to simulate or predict consumption in the census data. And what we did for the Ghanaian census is we did this 100 times. We did this prediction 100 times so that we, drawing from the variance that we had over our coefficient estimates. And then after doing this for over those 100 iterations, we averaged our final vectors for a final average consumption estimate. And then we use that to calculate inequality and poverty metrics at the enumeration area level. And so we have metrics that we could use for districts in Ghana, and this is the set of districts that were relevant in 2010. So 170 districts. It's now up to 216, I believe. But this allowed us to say something about district level, but we didn't need 100% of the census to do that necessarily. And so what we really focused on was looking at the enumeration area level estimates, and we could then identify places that were more that were high priority or had more extreme rates of low income or poverty. And in particular with the 100% census, it allowed us to take one small EA, one small enumeration area, which is a fairly tiny, pretty small geographic space. It's about the size, it's just a few city blocks is the size of an EA. But we have the full distribution of income or estimates of the full distribution of income from within these enumeration areas. So this allowed us to do things like, so this is an image of Greater Accra. So this is the center of the city is right around here. And so you can see all these enumeration areas are very, very small. But what you can see as this picture is changing is just us walking through the slice of income distribution that is in each of those enumeration areas. So here we're in the 35th percentile, now up to the 50th percentile. And you can see how the places that the people live changes, or the income distribution concentrations change based on where people live, right? So much lower rates of income, higher proportions of people in EAs are on the outskirts here. And then we can see as we move up the income distribution, we get pockets of wealthier neighborhoods in and around, but also not concentrated in central Accra. But being able to move through the income distribution here is pretty unique to having the 100% census data, but also using this small area estimation methods to try to understand that income distribution in a spatial way. And so then we took this base data set that we calculated, and then we were able to develop all kinds of different metrics from it by understanding that distribution within those small areas. So poverty is what we just looked at, sort of that income distribution in Accra. And we mostly focused on Accra because we also had really good detailed information on where those enumeration areas are in Greater Accra. For most of the rest of the country, we didn't have that level of detailed spatial information. We had it for Accra and for Kumasi. So we focused on these urban units. But we also calculated things like inequality. So you can see like the Gini coefficient here, but also other measures of inequality that are measured by these other entropy indices. But you can see measures of inequality spatially are in large agreement that these are the most unequal places in central Accra. We can also look at things like segregation. So this in particular looks at, are there concentrations of poor and concentrations of the wealthy in different places? And so you can see here that there are some EAs that are concentrated with with a higher proportion of poorer residents, some that have a higher proportion of affluent residents. But we're able to develop these kinds of metrics, right? Okay, so I don't know if there's, I'll pause for just 1 second, see if there are any questions at this point. That's sort of the base method, and then Alicia is going to walk us through some of the types of analyses that we've done from this, just to give you a flavor of how we've at least built on the small area estimations that we've done and use them in analysis. But I'll just say that there are lots of ways to also use the outputs from this method too.
Yeah. So shall we, as Brian was suggesting, shall we take question now or after? But if you have some question, or you can hold the question at the end. But is there any question?
One question from, I see Genevieve has raised her hand.
Thank you. Quite interesting. I see you are doing relative poverty. So what were you using for the relative measure?
We're using our person's our prediction of their consumption data is what we're using as the relative measure. We call it a relative measure and not an absolute measure because we developed these predictions, and so our predictions are in actual income units. So we could say that there's we could use their actual income to predict absolute income as well. But then we get into a challenge of, well, are the predictions that we're doing, are they accurate enough are they accurate enough to say this is a household's actual income, or are they just accurate enough to say that this household's income is higher than this household's income?
Yeah.
And we felt much more comfortable just using sort of the ranking of those than saying like our predictions are really good and they predict household income exactly for that household. Yeah. There are ways to do that. We could have, taken poverty rates and known poverty rates that come from GSS, and then made sure that our poverty rates actually match up with what GSS has estimated. And so we could have, it's like thinking about taking that income distribution and sort of shifting it up and down and like pinning it to where we think the actual spread of income should be, and also where we know poverty lines should be. But we felt comfortable just using this as a relative measure without having to go through that to try to suggest that our predictions were so accurate that they could be actual monetary values. So we've used our prediction values in a relative sense so far.
Yeah, thanks a lot. My internet was a bit unstable, but so I was just about to ask, why didn't you, the GLSS, they also calculate a final kind of a wealth measure of wealth instead of the consumption that you have, which is a collection of things based on policy and what they think is a true measure. Did you try to compare or use that one to do the same thing at the small area level?
No, we didn't. But there are other things that we had considered using as outcomes for the small area estimation as well. That could easily be one of them. We had interest in trying to understand expenditures on housing. And so we also were thinking about doing a small area estimation exercise for housing expenditures. And we also were thinking about doing it for medical expenditures as well, which the GLSS data have really fine detailed data on, you know, hospital expenditures and other medical expenses. But those are still in development. We haven't done those yet. Yeah.
Thank you.
Okay.
Just to jump in on this question, I think another reason we chose to do this is because of the tendency to underestimate urban poverty using like standard poverty basket measures and things like that, just because there's just not as much adjustment for cost of living. So using a relative measure, like defining poverty based on the population that lives in a particular area, was a way to kind of account for that and try to like look at, okay, who is at the bottom rather than who is considered who is not able to meet their basic needs at the national level, because that might be different in different places.
Yeah, I understand.
Okay, well, thanks for that good overview. Gives me a lot of room to describe a lot of the work we've done. So once we have our estimates and produce metrics, we can also use these to like examine the distribution of income, as we've seen before, and identify areas of like high poverty and high inequality, and use these estimates in combination with other information to understand how income is linked to health and well-being. And they can be not only important in understanding the effects of poverty, but you can also look at how socioeconomic status interacts with household and area characteristics to produce healthy or unhealthy environments. So they have a lot of power when you combine them with other data, particularly in areas where there's a lot of localized research activity, particularly at these small geographies. So in Pathways, we have a number of focus cities where there's been a lot of research activity in different domains. So we've been able to take advantage and employ these estimates to like really understand things beyond just monetary inequality and poverty. In Accra, we apply them to questions of mortality, questions of environmental pollution, water supply, and the like, to really look at how consumption and poverty interact with other phenomena and affect population health. Next slide, please. So one analysis that we conducted in Accra explores the interaction between these household socioeconomic characteristics and neighborhood socioeconomic status, looking at neighborhood effects and trying to interrogate how neighborhood effects like may impact well-being. So using our previously established metrics, the relative so using relative socioeconomic status, defining poverty and affluence, using the bottom 20% and the top 20% to look at the most the extremes of the distribution. And then we also define neighborhood poverty, neighborhood status by looking at that segregation variable that showed us where the ends of the distribution were most polarized. So essentially what that metric tells us is this area is has a high concentration of poor households. This area could have a really high concentration of affluence, or neighborhoods or more mixed. So really telling us about polarization using one metric. But in this analysis, we look at how these like household and location status interacts with what we define household well-being. These improved characteristics really that come out of the Joint Monitoring Program, a lot of the Sustainable Development Goal standards, and some of those agencies. So we defining household well-being by, do they have access to quality housing? Do they have access to quality energy or sanitation? And then looking at how populations in different areas are affected by either their neighborhood or their level of wealth. So if we flip to the next slide, we can go over some of the examples from this analysis. So these graphs show just 2 examples of our outcomes: improved toilets and improved dwellings, meaning that so these are presented as rates of these populations in these households. So do the poor have good access to, like, high rates of access to improved toilets? Do the wealthy have good access to like very high rates of improved dwellings? Ultimately, we found that household socioeconomic status typically matters more for improved outcomes. Has a larger bearing on most household decisions related to consumption of a lot of housing materials, energy use, and waste disposal services. But an important thing to note is that neighborhood location did play a very, very large role in outcomes, particularly those related to neighborhood infrastructure. So things like toilets or gray water sanitation, anything like even our water variables, because of the location, how important location is for, you know, the presence of piped infrastructure and where these infrastructures are located. But our key findings were really we see that there's a lot of interaction. So even if socioeconomic status matters more, the location does have a large bearing. I'll actually just describe a little bit of what we're seeing in these graphs. The top left quadrant shows outcomes for wealthy households and affluent neighborhoods. The top right shows outcomes for wealthy households and poor neighborhoods. And then the bottom row also shows these outcomes for poor households and wealthy and poor neighborhoods, respectively. So just within these graphs, we can see a huge variance in how people are able to access improved toilets. Yellow indicates much better conditions. Black indicates much worse conditions for that neighborhoods. So for toilets, there are many cases that the poor may have better outcomes in affluent neighborhoods than they do in, say, poor neighborhoods, where they would be considered in the in-group. This is heavily the case with toilets and Accra. It's also the case with some of those other infrastructure variables we mentioned, where, and the lesson here is that concentrated affluence can improve circumstances of the poor. So in a policy line that people think rising tides lift all boats, in some certain circumstances, policy targeting like socioeconomic status to reduce neighborhood disparities between groups might be beneficial for things like this. But in other cases, so for these improved dwellings, outcomes for the poor are actually much worse in affluent neighborhoods. This could indicate there's a large cost barrier in these places that are like, so even though maybe these services exist, they're just out of reach for poor neighborhoods or poorer households in these places. So if this concentrated affluence actually worsens outcomes for these outgroup households, one could really develop a more place-based policy to target socioeconomic status with these place-specific concerns. But ultimately, neighborhood status does not necessarily protect households. So even if you do live in a wealthy area, there are a lot of challenges in the urban landscape that you need to address in order to improve community health. All right, next slide, please. Okay, so now we expand beyond monetary poverty and kind of look beyond looking at non-monetary poverty, because urban poverty isn't just a function of these socioeconomic factors. It's an important indicator, but it doesn't fully cover the extent of deprivation, because there are a lot of different factors that influence the well-being of people and places. Next slide, please. So we can use similar approaches to estimate other outcomes like health. We can also apply poverty and inequality metrics to understand inequality and deprivation in other domains, for example, water. So, and then additionally, we can build more understandings or deeper understandings of poverty and inequality by linking all the data we have, particularly the socioeconomic data, to newly developed data sets. And we can use this to look at associations, but also between wealth or even causal effects. But really, what we can do is we can enhance our understanding of poverty and inequality. So next slide, please. So this is presenting some work estimating child mortality in Accra. Next slide. This exercise used data on counts of children born and surviving from over 700,000 women from age 25 to 49. This data set was taken from the DHS surveys that are very commonly available. But one of the challenges that there are some data mismatches, are some data scarcity. So initially we had to use a demographic method known as the maternal age cohort method to produce an accurate, like, I guess a robust estimate that we could estimate for the census. So due to challenges in sample size, we use a slightly larger geography than EA. We use the neighborhood, which is essentially clusters of EAs, but it really still helped us look at the spatial variation in Accra, even if it wasn't the most detailed geography. But for each neighborhood, we converted these summarized counts to an under 5 mortality rate using this method. And then we used the procedure similar to what was described above to take advantage of the direct estimates and the information available in the DHS and apply it to the census data. We slightly differently, this analysis used a Bayesian spatiotemporal model, which allowed for neighborhood specific slopes and intercepts. There were a number of methodological reasons for this that I will not get into, but just suffice it to say, there are a lot of different methods that you can use. So when you encounter challenges, like there are always tweaks you can make to, like, if you have data that is, just, it looks, data will never be perfect. So there are always adjustments you can make to improve your models and get robust estimates. Next slide, please. So ultimately we found that like a huge variance in child mortality rates across the city's neighborhoods. Interestingly, the highest child mortality rates were really found right in the dense urban center in a lot of industrial neighborhoods. Here, the average was about 95 deaths per 1,000 live births across these neighborhoods. Notably, no country has an estimated average child mortality rate as high as the highest neighborhood, the highest mortality neighborhood in Gama. Interestingly enough, peri-urban neighborhoods perform better on average, but rates across these areas were much more variable than they were as compared with the central urban areas. Next slide, please. So we can link our estimates to other data, which is what we did. We linked our estimates to other data at the I believe the cohort level, and because of these differences in between the heavily urbanized urban core and more peri-urban Ghana, we allowed for we estimated these differently for both types of neighborhoods, and we found actually conflicting relationships between these different geographic contexts. So we found that under 5 mortality was actually negatively correlated with multiple indicators of improved living and socioeconomic conditions among peri-urban neighborhoods. So in other words, the higher socioeconomic status in these areas was linked to much better outcomes. But despite all these the higher median levels of consumption and much higher levels of education among women in the urban core, the rates of child mortality were actually much higher. And child mortality tended to be a little bit higher in these better off neighborhoods in urban Gama. So the idea here is that the spatial concentration of people across this wide socioeconomic spectrum may actually generate these negative health externalities, where these local inequalities compromise the capacity of low resource individuals to meet their health needs. All right, you can flip now. Great. So the last we have two more, but should I kind of go quickly through this?
Yeah, people may have to leave at the top of the hour. I'm not sure. So maybe just touch on them quickly.
Great. Okay, so in this one, we just applied concepts of inequality to water information in Accra to look at water access across the greater Accra metro. Next slide, please. So we took data from the census, which has categorical data on 14 different water sources. So instead of just looking at which water source dominates, it didn't tell us enough about what was going on in the in each neighborhood. So we applied an inequality variable to water sources to look at how diverse EGA's water landscape was. So as some areas have access to the pipe network, while others do not, we really wanted to see where dominant sources overlapped with more or less, like say, diverse water environments, which could be a signal of stability or instability, depending on which sources dominated. Next slide, please. So just comparing the two, that previous dominant water source map with the water diversity map, we can see that piped water dominates areas with low diversity, which may signal that piped water is the more reliable option in these areas with well-developed infrastructure and may have fewer interruptions to the service. So people there may not have to search for other sources. But in areas where sachet water dominates, there's a lot of high water diversity, which may signal that low quality water service infrastructure and a reliance on these marked up vendor water from private sellers may place a heavy burden on the people who live there. And go to the next slide, please. So linking this entropy information, the water inequality information with socioeconomic information, we looked at where there were spatial correlations between the two to investigate how area wealth interacts with the local provisioning water landscape. So I'll keep this short, but a diversity of water sources or only access to only a single source could be good or bad, depending on what the dominant source is. It's really a marker of whether the water market choices are more limited or more variable. So, so in some cases, larger variety could indicate a healthy market or an unstable waterscape if it's a choice of mostly bad options. So just looking at the low, we'll limit it to the hotspots of low income people with low access or with a single water source. In some cases, this can point to a good provisioning landscape. In Tama, which is over in the eastern part, these low clusters rely on improved water quite heavily, the public taps and pipe-borne water sources. But in other cases, such as in Gaw South in the western bit, the arrows point to low income areas with limited choices that rely on pretty solely on unprotected rivers and streams. So really what linking this information does, it's a flag that tells you to, oh, we should like pay more attention to this area versus this area, even though, you know, socioeconomic status may seemingly be quite similar. I have the next few slides are on the multiple dimensions of inequality, which are a bit broader. Should I go through this real quick or should I wrap up?
Let's see. So either maybe you have recommendations, but my sense is that maybe we'll leave them in the slide deck and we can send the slides around. And if people have questions on them, then they could feel free to get in touch with us.
Great.
But
yeah, I think so. Yeah.
Okay.
I think we'll take questions. You know, this would be really good. Yeah. Okay.
Yeah, there we go. And we're wrapping. Okay.
Okay.
Yeah, we can just pause there and
yeah.
Ask if there are any questions.
Yeah, would happy to.
Right.
Yeah, would be happy to answer any questions or go through any other slides that you may want to spend a bit more time on.
Yeah. Okay, thank you very much. Thanks for Brian and Alicia. I think that's a really issue that we have been really struggling, that we don't have the detailed data, how we can really use those model and then the geospatial analysis to really answer some of the research question. And it was so interesting that you could use some of the other outcome. And of course, one of the interesting things we are doing in something is in Dhaka as well, where we couldn't use the 100% census data, but it's quite good that in Accra you use 100% census data. But the floor is open. Please, if you have questions, otherwise, I mean, please, I think if anybody has a question, and please raise your hand if I can't see them, or if others can see them. Anybody has a question? Irene?
Thank you, Zaid. I typed it in the chat box because of the time, but basically because the Ministry of Health Ghana has been a bit worried about some of the worsening health indicators and have this sense that some of it is being driven from urban areas. Listening to this presentation, it looks to me like some of your data is actually giving a pointer to some of these drivers. I'm just wondering, I mean, I don't think you can give all this information here. Is there any way to follow up, or maybe even to discuss some of it with Ministry of Health Ghana, or have you done that already? I know that you said the data is a bit old, but it's still a pointer to me as to things to look at and, if necessary, further analysis. Thank you.
Thanks, Irene. Yeah, I think you're right, especially the child mortality analysis. We were a bit surprised as well at the rates that we observed. And so this information is going through. I mean, we have the partners that we are working with in Ghana are mostly at Legon, they're University of Ghana, and have I don't know specifically that the conversations with the Ministry of Health have been that explicit, but certainly we'd be very happy to sit in and have discussions with them on some of this. I would feel like, as you said, that since the data are a little bit old, it may be hard to find actionable. So if we're able to do similar analyses on the updated census data, I think it could be a much more powerful message. And then we'd also have a little bit better idea about where trends are, if things are improving or still at about the same levels for some of these metrics. But I think that's a really great suggestion. So it would be good to have those discussions.
Okay, thanks. I'll follow up with Zaid about your contacts and then the contacts of your colleague in UG and see how we take it. Thank you.
Yeah, great. Thanks.
So any other question? Let's see, much question. Right. I mean, if no one is asking any question, I will take one thing as Brian and Alicia. You know that how we are taking this up in Dhaka, and we have problem. We are not. You have done much more better spatial analysis, and whatever data we have, we try to do something. And in our case, that we could only go down not to the enumeration area, but only the ward level, which is our administrative area. So the thing I would like to really bring in, because in your case, maybe in Accra's case, particularly where you had a census data, in Dhaka's case, we only had a 5% census data. That's why we actually developed another proposal, which is through Chorus, and I requested Chorus to fund that, which is through the innovation funds, where we trying to kind of validate that. But the issue I would like to bring in, like if we have a living standard measurement survey, and in Accra and in the Bangladesh cases in Dhaka, or from what we did from the household income expenditure survey, which is like mostly used by World Bank to kind of say that about regional poverty. What I was just thinking that, would you really suggest that, well, your household income expenditure survey should have a certain population compared to what you really use in census data. Is there any kind of a statistical reasoning to say that, well, it isn't good enough that, case, the living standard living survey, probably 18,000. And in a household expenditure survey, we maybe have a different number. So in applying this model, is there anything that any other studies, I have not really, as you have shown a lot of evidence and others that what this has been used, but poverty estimate you have done time. How would you say that, well, your living standard measurement survey, the area you're working, and if it is at a household level, it should be at least compared to a census level, have some relationship. Is there any method suggest that we should do that or something like that?
Yeah, I think, well, to rephrase a little bit, I think what you're asking is like, how do you know that your populations are comparable in some way? And I think that, I think for the detailed data sets that you have, in your case, the household income expenditure survey, the key there is that, you have a lot of really detailed information, but you don't necessarily know where people are or how, precisely enough, or you don't have the full spatial coverage in that data set, right? And then in the housing, in the census data, even if it's a 5% sample, that's okay as long as it's a random sample for that geographic area, right? And that's the key, is that you're sampling from the same general population, right? Conditional on their characteristics, and that the census data is a random sample that you can use to understand conditions in an area. As long as it's a random sample, then you can describe those average conditions, right? And so I think that's the key, is making sure that the census data is a random sample of the geography that you want to summarize information at, and that your other sample, that your detailed data set is from the same general population, but maybe isn't randomly sampled, or maybe isn't, doesn't have the same sort of geographic coverage or geographic resolution that you do with your census data, right? And that's where you borrow the detailed strength of one data set and use the spatial strength of another data set to build on each other.
Right. If there is any other question, because I can't take up another follow-up question or a follow-up from the presentation as well. Anybody would like to ask any other question? Anybody raised hand or not? Right. No, I don't see anybody has raised hands or not. But just to kind of also, like, I could see that when you say that, well, when we take it not at a small, in a central part of Accra, then we say that, okay, some region of Ghana, and then we can say that you say that it would be really good to have a kind of a separately for each region, and then you say that probably that's the best way, because each of the region could be different, and then it is better not as doing a nationally. So what would you recommend? I mean, like, if I want to do the same methods, I now understand the model, and probably as we say that we have another project which we will do validate, plus we will be working with the new census data or even new household expenditure data. So would you kind of suggest that whether it would be doing a national wide, because what I am quite interested to see that the poverty, World Bank, the poverty estimates, and they show particularly a division wise, or even to maximum, the smallest area as a district, which is still very large enough compared to what we are thinking about small area. So even if we kind of try to kind of a small area and at some of the national level, or even a small area in a particular division, would you kind of recommend that you do one by one region and then have the model and run your model separately, and then you come to those decisions? Is that what you would recommend?
Yeah, Ghana was big enough that we could break it up into regions and still have large, robust models. And if you're really trying to do validation and assessment in that way, then you're also going to want to make sure that your regional level, that your regions sort of that those predictions are in step with each other, right? So you may like look at neighboring wards that are in different regions if you have different regional level models, and make sure that the estimates that you're producing are not totally different between those two neighboring regions, perhaps. Okay. But yeah, I think especially being able to account for really different, and these are some of the
sorry, Genevieve.
Some of the
yes.
Some of the estimates that we were looking at here, which we didn't get a chance to talk about, showed how some of these metrics differ between different types of systems, right? Whether or not we're looking at agricultural areas or rangeland areas or smaller settlements or really dense urban areas, those are going to have really different, characteristics that are associated with income. In our case, so we felt it was important, at least for the diversity that's within Ghana, to break up those estimates in that kind of regional way. And for Bangladesh, I would imagine you would have similar concerns, given sort of the differences in livelihoods and ways of living between different areas of Bangladesh. So that's, I would say yes, you would want some regional differences there to help give you good predictors of income, but yeah, we could certainly talk more about the specifics as you get closer as well.
Yeah. Okay, Genevieve, did you want to say something, Genevieve?
Yeah, I just realized it was that was what I saw, those interesting multidimensional aspects, and for the whole of Ghana. So I just realized you really didn't mention, but it's interesting to see how it happens. And maybe if you can just maybe have another one, which is not a webinar, but more of how you did it, like looking at the data set. I mean, maybe a smaller group or something, how these were estimated, and then what the policy implications are. Then maybe I agreed with Irene. I mean, to make more sense to do this in front of the ministry, especially for the health indicators and all that. And then what's the next step for policy, especially in urban settings, given that we said that the indicators are really falling. And I mean, GLSS, they've only done 6, so we don't know what to do next. There's no new one, and we have a new census now, which is more current. So maybe, hopefully, there'll be the opportunity to do an updated version, which will look so that, like you said, we can do the trend.
Yeah.
Hopefully,
yeah, we'd be really excited to do that as well. But also would be happy to follow up in a smaller group or with a different sort of policy audience. And we could also bring in some of the other people that we've been working with to help make the policy messages a little bit more targeted as well, if there's a specific audience to talk to.
Yeah.
That would be exciting.
That's really good. That's good. Anybody else? Yeah, we're coming almost so hour and a quarter now. So, and any more question? I can see that some people have to leave, but I don't see any more questions or any hands raised. But I think, thank you, Brian and Alicia. And as you know, that we have been working, and some of the things that came up is always like, you've been using the old data, and it's really the whole purpose was to really, the way I've been working of the pathways and lessons learned from pathways to bring it to chorus, and even we could bring another different money. And we are really working with some of the other things with the pathways where we are measuring. We have measured, as Alicia has shown, that there was management, and we are also doing air quality. So we had also something like green space, and also something of some other socioeconomic and other factors. And we can see that how we can bring in this to poverty measures and probably with the new data which we had planned. But the one another thing is I could see some of the interest like Irene has raised and even Genevieve has raised, and probably we will sometime in the future probably will come together and as you know, it probably a different audience and come together and probably if we can do that. But thank you very much. It was really great, and it was our pleasure to have you and for your time, and your time and our time to match. It was difficult, but even then we could do it. And I would request you to send the slides, and probably we will also generate some of the other interests to some of the things which have been dealing with our MPH student as well. So that will also help us, and hopefully we could really bring us out also in our you know, for the MPH student separately, or it's bringing some of the people, a very small group or any other special group to talk more in detail. So I will end here unless if anybody else has anything to say. Request you to share the slides with us, and I will stop here.
Yeah, we'll send the slides along just after this.
Okay.
Thanks for having us.
Okay.
Yeah, thanks. It was an honor to be here. It was great talking with everyone.
Thank you.
I'm really
Thank you
happy to be
very
able
much.
to share the work, and
Yeah.
hopefully it's useful in some way. And please do be in touch for ways to exchange further in whatever ways are helpful.
Yeah.
Right.